Welcome everyone once again. Today the topic is on-demand innovation, and we have been thinking about this and discussing about this since 2 days, like how we can bring this technology into the hospitals. And what is important from point of view, it's one, developing the technology, and one is the application potential of this technology. So I come from Basel. Basel it's a beautiful city situated on the River Rhine. And here we have a university hospital, which is one of the biggest hospitals in the northwestern region of Switzerland with different 50 specialties. And we closely collaborate with our Department of Biomedical Engineering. So it's surgery plus engineering departments working together to bring this innovation forward. And going forward, I would like to present to you like what has been the potential of the past, present, and future of 3D printing in Basel. So as you know, the first CT scans, they were developed, or we got the hands on of this imaging technology in 1971, and then slowly we had access or the development of SLA technology. And in Basel, it was already possible, or the surgeons over there, they were so enthusiastic about the application or the potential of this technology even in the late 90s. And our Professor Zeilhofer, he's retired now, so he was one of the pioneers who initiated and brought this technology directly into the hospitals. The model, the pink one that you see, during that time, to acquire this model, it used to cost around $10,000. But it was still possible. He used to operate acquiring these kind of models in complex surgeries for its patients. Moving forward, his successor, our former Professor Zeilhofer's successor, which is the current chief now, Professor Zeilhofer, and Florian Thieringer. So Florian Thieringer, he acquired his first 3D printer because he learned and understood the potential of this technology for his patients. So the first printer that we bought, it was a small doodle-doo printer from USA in 2012. And in 2015-16, we established a point-of-care manufacturing or a print lab into the hospital. And now we are in this era. What we have, we have different kind of collaborations, new pioneer projects coming up. So the hospital also contributes and sees the potential of this technology. And we have flagship projects, which is one which is closely associated with Department of Biomedical Engineering. And then we have innovation focus, which is associated with University Hospital Basel. And this year in August, we were able to have our first in-house printed implant into the patients. And moving forward, you don't know what the technology could offer, but the potential of this technology into the clinical applications, it's immense. The future of surgery and what is being talked about the different commissions of surgery, there's a consensus or the general idea that 3D printing will make our surgery more precise, and it will even open avenues for different complex surgeries. And if you look into the publication records, we did a bibliometric analysis regarding 30-year potential of craniomaxillofacial surgery regarding 3D printing. And we see over the years, the number of publications in this field has increased a lot. Still, the pioneers are USA and China. Could also be because of the population number. But Europe is slowly getting traction, and we can see more innovative potential or more application areas in this area. So the 3D print lab in the Basel, it's closely located inside the hospital. And the idea we had was to have it together with CMF surgery department and radiology. So it's a joint collaboration between a surgeon and radiologist. And here we use training purposes and different even biomedical engineers into the training protocol for development, for their learning. And this is something that we do on a regular basis. So that's the main idea that we follow here. And we have different kind of printers from FDM, from SLA, for SLS, PolyJet, and depending upon application, we use our printers accordingly. One of the key area that we really want to build and we continuously work on, it's education and training. So it's not just the education of the surgeons, but also for biomedical engineers. So it could also be like anatomical models, which can be used for pre-bending the plates, which help the surgeons in their surgical expertise. but also simulations to give hands simulation models to give and improve the surgical skills prior to the surgeries. And we have been conducting a lot of courses regarding the application potential of medical 3D printing. And over the years, we have contributed to locally driven initiatives to also internationally driven initiatives. So we have undergoing fellowships in this field. We have also short-time traineeships in this field, and also hands-on application of what the potential of this technology is. And the key benefits of medical printing, it's not just a product in the end, but it's a multifactorial effect of this technology. We help it in patient education. It helps in the surgery to decrease the surgical time. Complications are decreased. It's a very good way for interpersonal communication between different specialties. So the 3D Print Lab in Basel, it's more like an ecosystem. So we collaborate with our different institutes to see the potential and apply them, but also internationally and nationally. And industry collaborations are something very important for us. A research institute and a hospital without an industry collaboration, it's not possible. So combining all these expertise or institutes together, it builds a really digital ecosystem. Now, the digital workflow in craniomaxillofacial surgery, you can see it has a different components. So it can starting from the imaging to the implant designing, to even printing, and there can be different biomaterials. You can also integrate more technologies like robotics and lasers into this whole digital chain workflow. And we use 3D printing as such, or virtual planning, in the whole spectrum of craniomaxillofacial surgery. So it can be in tumor surgeries, in trauma, in aesthetic surgeries, in cranial reconstructions, and even in dental applications, implants, and even patient-specific implants. So one might question or wonder, like, what is the need of this 3D printing? It all depends upon the complexity of your case. So the minimum level is virtual surgical planning. It's also help us to, before surgery, to visualize what a surgeon would anticipate, or even what a patient could anticipate, what could be the surgical protocol or how the surgery is going to come. And the highest level is the personalized implants in this complexity. In the next few cases, I would like to show how we use 3D printing and virtual planning in different kind of applications. So this is like a typical case. The patient had a fracture of the eye because of a fall, and a simple titanium plate was adapted. The patient was fine, but over the years, the green area shows like a cystic lesion which goes from the inside of the eye, protruding or keeping a bit of a pressure, and the eye level was a bit different. You can see it here. So it's a simple treatment, but the complications of this are immense because it's a very delicate region. And with 3D printing, it's very easy to visualize the different muscles region, different plate region. It also helps us to analyze during the surgery, like, okay, what are we targeting here, and how we could improve this application. Next are like tumors in the mandible region. The conventional treatment is to use the standard plate. You adapt it on the anatomical model, and it works fine. But it could also result, like after a couple of years, the standard plate could fracture. And now what do you do in this scenarios? So here, adapting a customized implant or fabricating one is very essential. And here, what we could use here, it's because of virtual surgical planning, the previous holes cannot be used for the same implant, so we changed the design and fabricated a customized implant in titanium with our collaborators. These days, navigation is something important. All of us like to go through navigated ways and not just go blindly to any, even at a venue. Similar goes with the surgery. So we use our navigation technology, even our surgical workflows. And how this looks like, even if there is a navigated markers, after a registration, the implant can be registered, and it can be guided to the planned surgical position. So the blue area is how the implant should be, and the pink area is how we are trying to adapt to the original position, how it should be during surgery. Innovation invites new perspective, which means you see a problem, but you need to think it a bit differently, how to approach it. And here comes the development of smart implants, which can be fabricated in new materials with the help of technology. And here we are working on two different aspects. These are high-performance polymers, but also bioresorbable implants. And in the development or the research area, we are working on composites as well. An example would be, instead of having a titanium implant, we could also have a carbon-reinforced personalized implant. And if you want to decrease the load-bearing or the material usage into this scenario, we could also have carbon-reinforced mini plates. Another applications are robotics into this area. Imagine we don't have to use any surgical guides or cutting guides in the future. So robotic is something which can, the pattern of the cutting, it's very intuitive. You can, instead of having a straight line cuts, you can actually have freeform cuts. So this actually helps in new surgical application, where instead of traditional straight cuts, you can have zigzag patterns or any other kind of patterns. And the application of these, what we have been testing now, it's a typical scenario, which is craniosynostosis, commonly happens in babies, in which the development of the skull shape, it's not uniform. So it could have a bulging on one area of the head, and the other area is not symmetrical. And the conventional, or what the norm currently is, we use a cutting guide in these kind of surgeries, and then we try to adapt manually our plates and try to see if the skull looks symmetrical or not. It's a pure hands-on surgical experience. But here we wanted to test if our backward planning and integrating 3D printing with robotics can have this kind of a workflow. And the results we have achieved so far in this simulation kind of a study, because of the robotic, because of a plan, we designed the plan before, it was easily possible for us to translate that virtual planning through the robotics. The cuts can be predefined. And because of the 3D printed implants, we already know how the bone segments need to fit together. Another application that we are working on is orthognathic surgeries, in which there is a deformity between the upper and the lower jaw. Either of the jaws could be either forward or too backward. And the conventional treatment, it's again, you have straight line cuts, which we do with the help of surgical guides. But if it's possible with robotics, it's possible to change, delete the surgical guides and use just a robotic laser. And you can already drill the holes with the laser. And these holes actually predefine our implant, which is actually 3D printed based on the backward planning that we did. So something similar like this. The jaws are cut with the straight cuts. And this 3D printed implant snaps fit directly to the pre-planned or the post-operative plan that we have to the aesthetic surgeries. And here you can see, like, from protruded or retrognathic jaw, you can have a straight symmetrical jaw areas. Next step in personalized medicine is something which is in-house printing of implants. And here we targeted peak cranial implants. The idea was, because of 3D printing, we can have a single-stage procedure in one go. There is also improved accuracy. And because it's at point of care, the turnover time is also decreased or the waiting time is decreased for the patients. What we could achieve for this, we have developed the whole workflow from the segmentation to the fabrication workflow into the hospital, and we have a 3D printer directly into the operating room. So in the hospital, it's more like it's also like surgical expertise. We are also trying to integrate the manufacturing capabilities here. And the workflow, it's first patient that we operated in August. It's a workflow which is developed on MDR compliance. And that's the patient that we operated. You could clearly see that he has a skull deformity. And starting from our in-house fabrication or starting with the imaging, we could easily design in a 3D print lab the cranial implant, depending upon what the anatomical constraints we need to consider. Sorry. And once that is done, it's very easy in the straight workflow to have the print file ready, and the printing of the implant is also done in-house. Here it looks pretty quick, but it took a bit of time. And directly after printing, we send it to the sterilization department, which is just one floor above our operating rooms. And during the day of the surgery, we get an in-house fabricated implant directly. And the benefit is it's a snap fit. It just fits directly. The whole surgery took around 90 minutes. So instead of before, where we used to wait for the implants, in-house printing is really very beneficial for us regarding this particular application. So the take-home message for me, from my side, it's in the field of CMF surgery, it's a very patient-centric approach. We work with different interdisciplinary departments, and there's innovation at the point of care. Print lab inside the hospitals, they are the platforms actually for technological transfer and also for innovation translation. So we can have different life clusters coming together. It's not just a team of surgeons, but it's a team of different people with different expertise, and also regulatory expertise are needed here. It's a platform where we enhance skills, not just of the surgeons, but also biomedical engineers. So it's also education and training and capacity building of an institute. Medical 3D printing, it's a key technology, and in CMF surgery, but also the applications can be extended to different other disciplines. And evidence reporting is currently, which is we really need to work on. This happens with our publications. So research activities needs to be more intensified in this field. We need to set up clinical trials and registries, because this is something which is missing in the current literature, and to also promote this technology further, to create a bit of more awareness that what this technology can do. And doing everything in a medical device regulatory compliance, it's something very essential. And thank you for my time.
A big applause for this very impressive presentation that you have shared with us. And we have a couple of questions for you. The first one is, are these treatments that you have shown, are they covered by the insurance company?
No, not yet.
Not yet?
Yes, so insurance companies, we are trying to negotiate with them and working with them. It's a continuous discussion, but currently it's not covered by insurance companies.
Okay, good. So then the second remark, of course, I mean, I guess everyone shares this was really a fantastic presentation. It says great presentation, and so thank you for sharing, of course.
Thank you.
So the last example that you have shown there, the patient that was presented, how is he doing today?
He's actually doing very fine, and what we realized, because he has been operated even before with he came in 2019, he had a fall, it was a stroke patient. And then eventually the bone started to resorb. And with that, yes, there are some physical challenges in the life of a person, but also psychological effect. So the person used to feel very low, not able to talk, or a bit hesitant because of the aesthetic deformity. But once this, the implant has been done, I see a huge or immense improvement in his level of confidence. So he's very outgoing, he's very positive in his life approach now, and also because it was our first case, he got a lot of media outreach as well.
Yes.
So he's very enthusiastic in general, and giving live interviews and about the whole experience. So it's a technology which has been in a very way accepted by the patient.
Yes.
So that is something that really improves the perception in general for this technology.
Okay, so a full success story.
Exactly.
Exactly, fantastic, yes. And then they have a question regarding more the economic side. So what do you actually do inside? So which kind of medical applications do you outsource? What do you do in-house? Yeah, you have shared some pictures.
So outsource is if we need a titanium implant, those kind of, because currently we don't have a titanium manufacturing printer in-house. So titanium implants are definitely outsourced. And regarding virtual planning, we handle everything in-house.
Okay.
Good. And also bioresorbables implants, especially for pediatric or in growing children, it's something that we outsource currently, because we are developing and working on it in parallel.
I see, I see. Okay, and there is the next question, which is regarding the future setup, whether they will be in-house, the print labs, or whether they are going to be outside, that you have external service providers. How do you see the future?
This is kind of like a challenging question because even though we have established a print lab, and yes, the insurance doesn't cover it,
Yeah.
so we ourselves in Basel, we need to evaluate how this technology will be and how we support the high acquisition cost for this.
Okay.
Currently, it usually runs through our research money. It's not through a government or hospital.
Yes.
But if a support is provided with the hospital, then it's a lot easier to sustain this.
I see, I see.